My name is Justin Lightburn, and I'm an interventional radiologist here at Goshen Hospital. Hemorrhoids are dilations of the veins in the rectum and anus. Hemorrhoids are a chronic problem for most people that suffer from them. They usually result in significant bleeding. Often they may result in pain. The standard treatments are initially dietary. If those treatments fail, then the patient will often see a surgeon for a hemorrhoidectomy. Interventional radiology has devised a treatment that blocks off blood flow to the arteries that increase flow and increase blood volume into the hemorrhoid. We call that an embolization. Once you block off blood flow to the artery, it prevents continued bleeding, and it eventually leads to clotting of the blood within the hemorrhoid and eventual shrinkage of the hemorrhoid. So the patient will come into day surgery, we'll take them to the interventional radiology suite, the patient will receive moderate sedation. So an interventional radiologist would treat the hemorrhoids via access to a vessel in the wrist or in the groin. We'd send our catheters into the vessels and inject a contrast agent to see where the hemorrhoids are coming from. We access the artery that's causing blood flow, increased blood flow to the hemorrhoid, and then block off flow with a number of coils that would prevent the bleeding. Once the embolization is performed, the patient will be discharged the same day, usually after a period of 2 to 6 hours of bed rest, and then they can expect cessation of symptoms probably within 1 to 2 weeks. So most often the bleeding, which is usually the most common symptom, is stopped after the embolization. Pain, which is probably the second most common cause of the problems, is often taken care of as well. People that are usually going to refer to us for these procedures are patients that are not interested in a surgical intervention and are looking for a more minimally invasive treatment, one in which they can return to their normal lifestyle in a shorter amount of time. So if the patient is experiencing the symptoms of bleeding from hemorrhoids or pain and they don't desire a surgical intervention, then they can always speak to us at the Goshen Heart and Vascular Center, and we can evaluate them for the possible procedure.